be your nurse for today.
Hi, what pretty girl.
Thank you. Can you confirm your name and date of birth for me?
It's Carol Sampson. September. What's my date of birth, honey?
September 22nd, XX.
Okay.
And you're the daughter?
Yes, I'm her daughter.
So what's been seem like? What have you been experiencing?
It just hurts a lot when I pee, and I just keep going.
Okay.
Keep going and keep going.
Any odor that you've noticed?
It's so embarrassing, but yes.
Okay. So I'm gonna just talk to the doctor and get some orders, and we're gonna just see what's going on, check some blood, check some urine, see what we have brewing. Okay.
I don't know if it changes anything, but the main reason why I brought her here is just because like she's been feeling really, she's been coming off as like really acutely confused.
Okay.
No, I have not.
Not like how she
For how
normally
long?
is. Probably about like the past week, so I would say about maybe like 4 days.
So
But-
have the symptoms, also the burning and the painful urination, has that been going on almost about that same time?
So she just reported it to me probably about like a day ago or two.
Okay.
But the acute confusion has been going on for about like a week now.
Okay, so let me go contact the doctor. We'll
We just
get
have to
some
wait to see if
labs
they
and
do some tests.
I'll be
okay?
right back, okay?
I just want to go home.
I know.
Hi, I'm Erin. I'm the attending here.
Hello.
I'm gonna do some orders for you.
Okay.
And can I have your name and date of birth, please?
Carol, September 23rd, 22nd. I don't remember.
Okay, thank you. I'll get right on those. So Carol, I do have to draw some blood and we are gonna get a urine.
Oh, good, because I have to
Specimen.
pee so bad.
Well, that's great. Can you see your bracelet? And again, your name and date of birth for me.
Carol Sampson, September 22. XX.
Okay. I'm just gonna look for a vein, we're gonna get some blood, draw in the blood, and then I'm gonna take you to the bathroom so we can get that urine, okay?
Oh, good, thank you, thank you.
Okay. So Carol, I'm just gonna take these labs, the blood and the urine, and send them down to the laboratory so we can get the results for you and then get an answer as to what's going on. Okay. Hi Carol, can you confirm your name and date of birth for me?
Again?
I'm sorry, I do have to do it. It's a safety check and it's for your safety.
It's Carol, September 22nd, XX.
Okay, so just a quick overview. We did get the results back. You do have a little bit of a UTI, not uncomplicated UTI. So we are gonna have to start you on some medicines, which I have here for you with the drink.
Then
The
can I
first
go
one,
home?
we have to get you started and see how your levels come. We have to redraw levels and check that it's improving before we can send you home, okay? We don't want it to get worse and then have you go home and just be right back here.
How often is she gonna have to take her antibiotics?
The antibiotics are twice a day,
Okay.
You're gonna have
and
to
they're
do
gonna
that
be
for me.
for
Yeah.
10 to 14 days.
10 to 14
Yep.
days? Okay.
So what the doctor prescribed was Bactrim, which is your antibiotic to help flush the infection out, and he also prescribed pyridine, which will make your urine yellowy orange, just so you're aware before you go to pee. But it will help with the burning sensation that you're having and the discomfort, okay?
Can you open this for me, honey?
Of course.
I'm a little old lady. Thank you.
They went down okay?
Yeah.
I guess they didn't taste good. Pills aren't made to taste good, I will tell you that. Okay, so like I said, the Bactrim is going to be twice daily, so every 12 hours we'll be giving that to you. So unfortunately, we will have to wake you up a little bit later on in the day to give it to you. And then the pyridine is only going to be for 2 days, so you'll be off of that before you go home. Okay?
How long do I have to take the antibiotics for?
10 to 14 days.
But what if I feel better 2 days from now?
You need to keep taking them even if you feel better, because even if you feel better, there still could be bacteria there.
No, I hate taking pills.
I don't
And that's
blame you.
okay.
Okay, so are you
We'll make
able
sure.
to? Okay.
Yes, absolutely.
And then with another thing, can you tell me how you wipe when you're going to the bathroom?
Oh, I have this arthritis and it's just so hard sometimes.
Oh, I understand. Are you doing front to back or not so much?
Yeah.
Yeah, that's a huge thing that we need to make sure that you're doing. Proper hand hygiene before, making sure that you don't have anything stuck to your hands or you weren't touching anything that could have been, had a lot of organisms on it before you're going in there. And then wiping front to back especially, because what we found in your urine was E. coli, which is mostly presented when you tend to wipe back to front.
Oh, that's so
So to-
embarrassing.
It's okay. We all go through it. We're all women here. So to prevent them from reoccurring, we really do need to wipe front to back. Okay?
Can I go pee?
Yes, of course. So while we went to the bathroom and while we were walking, I just thought of one other thing that I meant to mention to you. While you're going through all this and while you have the infection, you do really want to increase your fluid intake. I know that it's not contraindicated with your past medical history, so we really do want to up the fluids to about 2 to 3 liters per day to flush the infection out, especially because you won't be going home on IV fluids like we have you on here.
So I'll have to pee more?
You will, but it's going to help in the long run because you won't have the pain after you flush it all out, and you'll be returning to your normal. Okay? Do you have any questions for me?
Can I go home now?
Not yet.
I
We
have
do
to go
have
see
to
my
repeat
friends.
labs.
I have a question actually.
Yeah.
Is there anything that she can take that can like prevent the UTIs from happening in
So,
the future?
I don't know if she likes cranberry, but
Ooh, my
you can
friends
drink.
have talked about that.
You can drink cranberry juice. They also, if you don't like drinking cranberry juice, they do have cranberry pills that you could use prophylactically to help prevent it.